are located between ribs and sternum just in anterior. The second costal, or ribs in Latin words. The second costal cartilage here is attached to the sternal angle. Here is the sternal angle, and the second costal cartilage is attached to the sternal angle. The seventh, 1, 2, 3, 4, 5, 6, and 7. Seventh cartilage bounds to the upper part of the infrasternal angle. Here is the infrasternal angle, and the seventh costal cartilage is attached to the upper part of this angle. The lateral border of the rectus abdominis muscle is one of the abdomen muscle, or the linea semilunaris, join the costal margin at the tip of the 9th costal margin cartilage. The 10th costal cartilage forms the lower part of the costal margin. Here is a 10 costal cartilage that is the lowest or lower part of the costal margin, and then about 9 costal cartilage we have attachment to the one of the muscle of the abdomen called rectus abdominis. Ribs are another bony landmarks of the thorax. Ribs, you can see here in the lateral side of this thorax we have a 12 ribs on each side that attach anterior to the costal cartilage and posterior to the vertebrae. As you can see here, posterior vertebrae and anterior sternum. The scapula is one of the bone related to the upper arm. The scapula overlies the 2nd to 7th ribs. Let me show you in a good shape to you about this. The scapula overlies the 2nd to 7th ribs on the posterior lateral aspect of the chest wall. The 10th rib is the lowest point, lies at the level of the 3rd lumbar vertebrae. Though the 11th rib is longer than the 12th. Both of them are confined to the back, are not seen from the in front. So the 11th and 12th ribs are called floating ribs or abdominal ribs. And the last bony landmark of the thorax is the thoracic vertebral spine. The first prominent spine felt at the lower part of the back of the neck is that of the 7th cervical vertebrae or vertebral prominence. You can touch it on your body. If you can touch it in a lower part of your neck, you can touch a prominence body on your back that is called vertebral prominence. It's related to the 7th cervical vertebrae. Below this spine, all the thoracic spines can be palpated along the posterior median line. The 3rd thoracic spine lies at the level of the roots of the spine of the scapula, and the 7th thoracic spine lies at the level of the inferior angles of the scapula. So all of them that I said about them are bony landmarks of the thoracic cage. And I'm going to talk about the soft tissue landmarks related to the trunks. The number one is nipple. Let me change the shape to this one. We have a nipple on right side and on the left side. The nipple, the position of the nipple varies considerably in females. I mean, in the female, the position of the nipple is varies, but in males, it usually lies in fourth intercostal space about 10 centimeter from the mid-sternal line. Here is the mid-sternal line, and the nipple is about 10 centimeter from the mid-sternal line. Apex bit is the second soft tissue landmark of trunks. Apex bit, here you can see apex bit. In other words, apex bit is the apex of the heart. It is a visible and palpable cardiac impulse in the left 5 intercostal space, 9 centimeter from the mid-sternal line, or medial to the mid-clavicular line. Here is a mid-clavicular line, and the apex of the heart, or apex bit, is located medial to the mid-clavicular line. Another structure, soft structure in the trunks, is a trunca. Here is a trunca. Trunca is a palpable in the suprasternal notch